clinical impact.
Yeah.
The clinical impact, firstly, the adjuvant endocrine treatment that saves a lot of patient lives. If we use the tamoxifen or aromatase inhibitors, for instance, for 5 years or 10 years treatment, that would reduce the distance, the recurrences about the 40 to 50%. Do you understand? And also in metastatic setting, combined with the CDK4/6 inhibitors, that would prolong the progression-free survival. It's quite significantly according to recent study outcomes. And this is just a simple example how the endocrine treatment is important for breast cancer treatment. And in estrogen receptor positive cases, the endocrine treatment is used as a standard baseline anyway. So that's about 70% of the patients, breast cancer patients, are estrogen receptor positive. So most of these patients are treated by endocrine treatment a very long time, as I mentioned. So it's a kind of the core of the cancer treatment for not only primary breast cancer, but also for metastatic breast cancer patients as well. And we have the many types of the endocrine treatment. The initial endocrine treatment was discovered more than 100 years ago in Glasgow. Beatson, he was a surgeon. And they then developed the surgical endocrine treatment, a surgical ablation, then drug treatment. As I mentioned, the tamoxifen, that is most famous one, and aromatase inhibitors for postmenopausal. This is also extremely frequently used. And then the estrogen receptor downregulators, etc., etc. We have the more than 5 classes of the treatment in endocrine therapy. Okay, Ravi, can you help me?
So the tumor microenvironment obviously has different types of cells, and interacting between each type of a cell, whether it's between cancer and the immune cell and the microenvironment, has a lot of impact. Recently, one of the studies from China, I think they clearly showed that the microbiome itself, I mean, earlier the belief was that microbiome had very little or no role in tumor metastasis. But for the past 5 years, it's been proven that the microbiome actually has more role to play in metastasis rather than the initial tumor growth. So the Chinese study, they proved in mice that when the microbiome are targeted, rather than the initial growth of the tumor, metastasis can be controlled. So in that sense, identifying the markers associated with the microbiome, probably after the first phase of the treatment, could help target any potential metastasis. Mark, any comments about the immune microenvironment?
I think the host, the stroma, and the host system, the tumor microenvironment, and other host system, for instance, neuroendocrine system, and also the microbiome environment. These events, these issues are quite complicatedly associated with each other. And now we are getting understanding gradually, and we understand it is important, as Ravi mentioned, we can raise many examples. However, still we don't know the entire view of these associations. But sometimes, in terms of the tumor progression, metastasis, for instance, stroma can work, or the host can work anti-cancer. Sometimes, it can act as pro-tumor, promote the tumor. And that is a simple explanation of how it is complex. And the recent technology, using the recent technology, we can understand step by step, the item by item. That is my understanding.
Just to add to Mark's comments, I think the study I was referring to from China, it's an amazing study published in Cell Journal, I think as recently as in probably April, maybe, from, I don't remember the name, Hang Zhao by Kai, Professor Kai, I think, Shanghai. So I think that's one of the best papers that's been recently published on the role of microbiome in tumor microenvironment and metastasis. So I think the readers could be very, very excited to read that paper as well. Thank you.
Multidisciplinary treatment. One treatment is not good enough to suppress the metastasis or tumor progression. This is a history of the treatment for breast cancer. In terms of the primary breast cancer treatment, and the surgery, radiation, local treatment is still needed. And the systemic treatment, now it is consisted of the chemotherapy, endocrine treatment, and the multiple molecular targeting treatment, for instance, anti-HER2 on the CDK4/6 or the PAP, or etc., etc. And also now we got the immunotreatment, immunotherapy, anti-PD-1, anti-PD-L1 treatment. That is quite marvelous. But each treatment is very powerful. It's a very significantly effective. However, the combination is important. And also stratification by tumor subtype. As I mentioned, the estrogen receptor positive, that means the estrogen-dependent tumors, and also the HER2-dependent tumor, HER2-addictive tumors, and it's a hormone receptor negative, HER2 negative, the triple negative subgroup. It's a mixture subgroup of breast cancer. And the stratified by tumor subtype, we need to think about different treatment strategies. It's a very advanced, the recent 20 years. And nowadays, it is conducted by a strategic concept, which is the escalation of treatment or de-escalation treatment, which is provided by information on the prognosis. The precise prediction of prognosis can help to identify which patient needs escalated treatment, which patient do not need the escalated treatment. That is the escalation, de-escalation treatment. And additionally, at last, we quite recently got the PARP inhibitor, which is just used for BRCA, hereditary breast cancer gene, pathogenic variant, positive cases. And this is a new paradigm in breast cancer treatment. The genetic background, they suggest the appropriate treatment for these particular types of the patient. So these things are complexly emerging and the advancing. Just a clinical explanation, and the more basic the explanation, I think they are quite possible if Ravi, you would have.
I think in terms of identifying the patients who could metastasize, I think Professor Toi's group, I think they are developing very advanced imaging technologies. And also globally, I think the liquid biopsy technologies are extremely getting more and more popular, and especially, but I think the flip side is that they're not common across the patient spectrum. So that could be one reason or one drawback or a challenge for using the liquid biopsies across the different cases or different patients. Yeah.
Yeah, it is absolutely true. I just mentioned on the treatment side, but the diagnostic side, it's really advancing now. So that the liquid biopsy or the imaging, it's really important. Yeah, I totally agree with you. Hotspot, the clinically, the immunotherapy. The last year, this year, the immunotherapy for primary breast cancer is now possible to use. That is amazing. The currently mainly focusing on the triple negative breast cancer, which is one of worst the tumor subtype in breast cancer. And the immunotherapy may change the treatment paradigm of breast cancer totally. Still, we don't know the details or mechanisms how the immune system work for breast cancer. Nowadays, we've got a lot of data, but still we don't know much about. Still, we need to analyze more. And to analyze more, to understand more about our body itself, the immunotherapy would be extremely important. Obviously, to treat a patient is very important, but also to understand what happens in our human bodies. The immune aspect is maybe the central part of it.
I think from the research perspective, I think if you ask for the hotspots, I think obviously the tumor microenvironment, which Professor Toi has mentioned, which involves immune cells. That's extremely important. However, having said that, I think for the past 5 years or so, the immunotherapy clinical trials in solid tumors like breast cancer, I think the response rate is not so high. It's still around 10 to 15%. So there is a lot of opportunity to identify the resistance, the reason for the underlying resistance, why some patients respond to the immune therapy, but not many doesn't in terms of solid tumor treatment. So I think that could be one of the hottest research topics, which can be for another decade or so. And then obviously, as you touched on the microbiome, I think that could be one of the research aspects that we all can explore. And I think,
yeah, sure, please.
I think the third one is, which Professor Toi is very much heavily involved in, the clinical trial aspect. So I think it has to be ethnically driven and more integrated clinical trials across the globe.
Yeah. And also in terms of the drug treatment and the development, the drug delivery system, we got a new subclass of the drug delivery system. For instance, antibody conjugated the drug, the system. This may change the drug treatment, the paradigm a lot. It's already changed, but it's going to be changed a lot. It's going to change a lot. The DDS system is quite interesting. That's closely associated with tumor heterogeneity and also tumor microenvironment. And we have the particular the properties of the tumor microenvironment. This the DDS system can work on it, or can work even in the difficult situation of microenvironment. So I just would like to add this aspect. And you mean in the research, the interest? You mean research interest or
Yeah,
the multiple items we have? In terms of laboratory research, the interest, I guess, so genomic analysis or genetic analysis, and also immunology analysis and imaging. That's the major three parts. And also we are interested in the mathematical modeling. And I've been involved in many years. And also in recent years, the artificial intelligence, the analysis or development. That is the number 4. And regarding the clinical trial, already mentioned the targeting treatment, including the immunotherapy and also the DDS. That would be interesting. And the liquid biopsy, as Ravi mentioned, that would coming very importantly in adjuvant situations where the imaging, the trials, the recent new imaging is quite advanced, and the body, what to say, molecular imaging is now becoming possible. And we can see what happens in human body through imaging. So this is a new advances. And what else? So like that.
Spatial?
Yeah. Oh, so spatial, okay.
Yeah, I mean, Professor Toi's group, we are starting a couple of projects on spatial transcriptomic analysis to understand how the tumor microenvironment could influence the response in the resistance.
Sure.
That could be another one. Yeah.
Right.